I think I got it.
Content of this meeting is being sent to a third party. Just check,
Super.
got it?
I think we're live streaming. Hello, everyone. This is Jen Gardella, and I am here with the very lovely Kim Everett, our Executive Director of BCHIP, located in Newtown, serving all of Bucks County's health needs, I would say. Coordination, access to information. We just had a huge blip so I'm going to let Kim introduce the organization, and I'm going to make sure that we're live streaming in the right place. So go ahead, Kim.
All right. So thanks for hosting today. Happy to be here and talk a little bit about findhelp.org. So it's one of the initiatives that BCHIP is kind of taking a lead on, and it's good all around in that it can help the general community try to find help that they need around things like housing and food or other items, maybe help with pet care or and then it also is very helpful for organizations to help track referrals and be able to provide loop closure. So I'm sure we'll talk more about it, but have you figured out, are we streaming correctly? Are we good?
We're streaming somewhere. It won't tell me where it is yet, but it'll show up eventually. How does that sound?
Oh, good.
It does say that we're live streaming, so we'll have to find it later on.
All right.
Okay, so it is findhelp.org is a website.
Yes, ma'am.
So you go to the website, you put in your zip code. So you just literally go to findhelp.org. And what do you have access to there?
So you put in your zip code, and then it can translate into over 95 languages. So if language is a barrier for someone, they can access this information that way. And if someone is in need of housing, or if they're in need of food, like I said, or transportation, or if they're looking for support around mental health or substance use disorder. So there's a bunch of categories that once you go on to findhelp.org that you can search on. So as somebody who they would call a user or a seeker, the general community can just use it. It's completely free. And you can request information from those resources that are on there, and they can contact you directly through email or by phone. Or some websites, like ours, we have the link to the BCHIP website. We're on there for our smoking cessation programs and for our advanced care planning program. So if someone was looking for advanced care planning and they put that in, BCHIP will pop up and they can go in and it will send you to our link, and you can follow our registration process and get registered immediately for it. Or you can register, actually, you can put in a request for information on findhelp.org as well, and we'll get a different email, and we know to follow up with you directly and share the details about how to register.
Okay, so that sounds like it's a lot of information. So if I am in Bucks County and I'm experiencing, let's just say, homelessness, can I go in there or?
Now, sadly, I mean, that is one of the topics that is most searched. And sadly, we know that that's one of the biggest barriers we have right now, right, is housing. So while you will find resources and you will find links, it might not, you might find things that you're not aware of. So while you might not find a shelter immediately, because we know that we have a waiting list for the shelter or a waiting list for housing in Bucks County, you might find things that could help you stop from being evicted. You might find programs like from the Opportunity Council where they have rental assistance, or you might find a program around utility help, or you might find nonprofits that are willing to give you like one-time support to kind of get you over the hump. And then, while you're waiting for additional resources. So there's lots of different programs that you can find. So I'm putting in utilities just to see kind of what comes up for me as well.
Okay.
So you'll see there's lots of different programs in there that will provide information and resources about getting help with your utilities. And that they're local, and you can reach out to them and try to get help if you weren't able to pay like heating bill or an electric bill or things of that sort.
Wow, I wonder what's under care. That sounds fascinating. So if you're having, like we were just talking about some problems in my family sometimes with care for individuals who need assistance moving around in the world. And sure enough, physical safety, residential care, support care, animal welfare. That's awesome. So why do you think that this is important for Bucks County right now?
I think it's important because it's great for people to be able to use it themselves, but I think the bigger level and the higher level that I love about it is that our healthcare systems are using it. 4 of the 6 healthcare systems in Bucks County have it in their electronic medical record, so in their record in the hospital. So for instance, if you have a patient and they have diabetes, and the case manager says, you have access to nutritional food at home, and the patient says no, they can go into the record and make a referral in the electronic medical record to 2 or 3 of the food pantries in our community. The patient is copied on that information, so they see it, and they have the information for follow-up that's not just in a pack of discharge papers. And then in a perfect world, and we're not quite here yet, but in a perfect world, the food pantries will be able to catch that referral. They'll follow up with, say, Mr. Smith that was in the hospital. They'll reach out multiple times. They'll provide the resources or the information that's needed. And then if Mr. Smith gets help, they'll notify the social worker and say, and this is of course with permission of the client, Mr. Smith did come and was able to receive the services that he needed. Thank you for the referral. Or they will say, Mr. Smith did not come. We're sorry that, he didn't have his needs met. Thank you very much. Now, Mr. Smith, 4 months later, is back in the hospital from the complications of his diabetes. The case manager can go in and look at that and say, oh, Mr. Smith, you didn't go to food pantry A, B, or C. Is it because you didn't have transportation? Is it because their hours weren't conducive? Is it because they didn't have the nutritional foods that you needed? Or did you just choose, you didn't want to, right? And so instead of just giving a patient a brochure that says, here, go get this food, right? Now we can actually try to be more intentional about making those referrals and getting the outcomes that we want. So now let's say I'm, hospital A, and I make donations to food pantries because a lot of our hospitals support some of the food pantries in our community.
Okay.
And I'll say, oh, okay, my funds this year, let's see, did food pantry A provide me loop closure on my patients so that I know what's going on with them? Or did they not? Or did food pantry B give me the feedback that I need for my patients, or did they not? And then where do I want to put my funds? Now, I'm not saying that just because the food pantry that gives loop closure should get the funds. Maybe it should go to the one who isn't because they don't have the resources to give the loop closure, right? But it helps us be much more intentional about where we're putting our funds to address the needs of social determinants of health instead of just putting out a brochure that says, here, this is what's available. Is it really meeting the needs? And so that's where we're hoping it goes over time.
So you used an important buzzword in your industry, loop closure. Are you finding that that's a problem?
Well, the problem right now is that our health systems have resources around this, but our community benefit organizations, folks like Family Service and Opportunity Council, they're wonderful organizations doing fabulous work. This will require them to take an extra step right now because right now the system doesn't talk to their internal system. So it takes an extra step. And so in fairness to some of our community partners, not all of them, but some of them are like, look, we don't have the resources to do this. So we want to support our health systems and we want to support our community members, but we don't have the resources. So what BCHIP has done is we've gotten a small grant to get our staff trained in being able to provide technical assistance to the community partner organizations. So trying to help them develop best practices to make it the least amount of work possible to incorporate this into their systems.
While still providing the feedback so the hospital or the partner knows that,
right.
wow. Right. Another interesting question that buzzed into my mind when you were speaking. So in order to use the services of a food pantry, do you need to be referred in?
No.
No, okay. So if you go on to findhelp.org and you make contact, you don't need to have some sort of case manager or social worker that you're dealing with.
No, that's a great question. You don't need to do that. But the nice part is it is a free service. And then even as just say a community member that is, somebody in their neighborhood that everyone's always going to for resources, we always know that, call John down the street. He always has the answer, right? Well, if John wanted to, and I'm not saying a general community member would do this, but it's all free. So John could set up his own little account on findhelp.org and he could make referrals, and he could find out if the people he's been trying to help were actually helped by those services. So that's all free.
And what about this? That's fascinating. What about if John has a car and can drive people around?
He could put himself in there as an organization
Huh?
to, like, you can, yeah, I mean, now I think Find Help would probably vet it, and I'd have to find out the details of that, but
Right.
yes, they could. I'm sure there's a way they make sure that this person is legitimate and safe and all those kind of things, but an organization can go in there and it is vetted by findhelp.org, and then they could be a resource on there if they wanted. Mhm.
Okay, that's fascinating. So, and it's very, very confidential. So you're not calling into a
Exactly.
hotline to get, a variety of 1-800 numbers or, to start making calls.
Mhm.
Wow, good stuff.
And then as an organization, as somebody who uses it, BCHIP uses it for some of our programs. It's really helpful. You can see where your referrals are coming from. You can see if those referrals were successful, if they weren't successful. It allows us to track completion of participants in some of our programs. So the data you get as an organization in the back end is also extremely helpful, and it's all free.
And we know where there's data and research, there is grant opportunities. And without the
Yes.
data and the research, there's no money available. So
This is true. This
okay,
is
well,
true.
so this is good for any community partner in the healthcare space. First of all, that doesn't know about BCHIP, please contact Kim and her team to find out how you can work in. But also, if you are looking for help yourself, or if you are an organization that has services to provide, get yourself on Find Help. That is awesome. Findhelp.org. I'll put the link in the chat when we're done.
Perfect. Thanks, Jen. I appreciate your help today.
So we have some sad news in that in 2 weeks, we will not be coming live on Facebook because it will be
Ho,
the
ho, ho.
holidays. And Kim and I are not going to be speaking on Christmas. Although sometimes with family holidays, I'd rather be speaking to someone from work than
I'll
anyway.
plead the fifth.
Actually, at this time in 2 weeks, the Eagles will be playing,
That's true.
is it the Giants? So it will
I believe so.
So it
Yeah.
will be a brawl in my house. It will be a fabulous Christmas here. Um, but so you have a happy holiday. We wish everybody
Thank
out
you.
there in Facebook BChip Live World a happy holiday. And who knows what we'll be talking about in the new year.
You never know.
Something related
Thank
to
you.
healthcare.
Happy holidays.
Thanks, everyone.